COVID-19 infections in KwaZulu-Natal continue to rise, and life is not made easy by the fact that some communities have little to no access to proper sanitation and healthcare. Premier Sihle Zikalala is expected to assess the impact of COVID-19 at Umkanyakure municipality today. The province has recorded more than 15,000 COVID-19 cases and 183 deaths. Well, eNCA's Tuba Vilane is following that story along with the officials as they visit today. Tuba, very good morning to you. So you spoke to the Premier earlier during this visit. What did he have to say?
Yes, good morning, Yuveka. Indeed, we're here in Umkanyakure district at the Morsford Hospital in Ngwavuma. This is the city, Yuveka, that is bordering the Swaziland, the neighboring country. We understand that beside the population of this area that this hospital has to deal with, but they also have to deal with the influx of people that are coming from the nearby country that looking for the health services here. I'm able now to speak to the MEC of Health, Nomakuku Smelane Zulu. Mama, thank you so much for your time. Let me first talk about the equipments that you are going to donate to this hospital. One was asking me why it has taken COVID-19 for government to deliver these equipments.
Good morning, Tuba, and good morning to the viewers. I must firstly indicate that the equipment here is not being delivered by government to the hospital, but we are receiving it from the company DeFi, which is handing or donating to the Department of Health. Now, what we decided to do as a Department of Health is that instead of just giving it to one particular facility, let's look at all the facilities that we are reconfiguring in the province, and Morsford is one of those facilities where we have started preparing for COVID-19. In other words, we've created new wards in this particular facility. So some of the appliances that are being donated today by the company are going to be going to that facility. But this is not the only hospital that's going to benefit. Hlabisa Hospital in this district is also going to benefit Manguza Hospital, because those are all the hospitals that have wards and beds that are being recreated.
MEC, this particular hospital that we're talking about here, beside the population, its population, they have also to deal with people that are coming from Swaziland. What is government doing to ensure that facilities and equipments that are here are being used for people, the locals?
Well, you know, this particular district, Tuba, doesn't just deal with people who come from Swaziland. We also deal with people who come from Mozambique, because as you go down the coast in Manguza, for instance, Manguza Hospital has to deal with patients that are coming from Mozambique. Now, as you heard the Premier indicating earlier on, it's one of the challenges that we have, and it's one of the concerns that are seriously very up there in our agenda, because it means we are utilizing the taxpayers of South Africans to be able to look after patients that actually don't come from the country. So there has been some programs that through the Office of the Premier we've managed to put in place to ensure that we look after government looks after the border and strengthens the crossing, and that is what we are working on. As a Department of Health, we don't turn people away, but what we do is that we then keep a list of who are we treating and who have we seen and where do they come from, and then hand it over to the Office of the Premier.
Very lastly, MEC, we've seen the number of infections increasing in the province. It's now starting to affect even the rural areas. But the issue of understanding among the rural communities is still a problem, social distancing especially.
Tuba, we are extremely worried about that. You know, when you walk around sometimes in townships, in rural areas, you find that people are not wearing masks. They are sitting together, drinking alcohol sometimes, and sometimes just chatting. This is something that we have decided as the Provincial Command Council as of last week, that we need to get a whole new kind of messaging that goes to our people, that's going to be targeted to the rural areas, that's going to be targeted to our townships, so that they understand that this is not, this virus is there, and this virus can kill if we don't take precautions. So we are in a process of establishing a new communication strategy, of talking to our people. Usually, as you would know, we'd go to our communities ourselves and engage with the communities, but because of the regulations and because of the rate of infection, we can't go to the communities. Then it means we need to start talking to our communities through yourselves as the media, through other means, and we are looking at these other means. But we also are calling on the media to actually assist us in strengthening this particular messaging, because it's the only way that we can get to our people right now.
Thank you so much, MEC.
Thank you very much.
That was the health MEC, Umamune Makukusmelane Zulu, saying they have realized now that they need to use a different method in order to try and get a message to the masses, because it looks like many people, or the majority of people in rural areas, they are not adhering to lockdown regulations.
All right, well, I suppose that's one of many forgotten municipalities, Tubavilani, there in KZN.